Hello everyone. So today we are going to discuss about compartment syndrome. Very important topic. You must have to know about compartment syndrome. So number one point which you must have to remember that it is compartment syndrome. It is a medical emergency. Okay, because if you are not going to help the patient as soon as possible, it can lead to muscle ischemia. Okay, it can lead to muscle ischemia and other problems in the patient. So what is a compartment syndrome? So it occurs when there is increased interstitial pressure within a closed osteophysical compartment, resulting in microvascular compromise. Okay, as you all know that compromise. Okay, so what is the most common cause? It is the lower limb injuries, or you can say lower limb fractures, both open and closed. One can lead to compartment syndrome. It can also occur in soft tissue traumas. It can occur in arterial injuries also. It can also happen in patients with burn injury also, or it can also happen in patients who is having prolonged compression. For example, if you place the cast too much tightly, or tight cast application can also lead to compartment syndrome in the patient. So what will be the clinical features of the patient? So the clinical features of the patient: number one, patient will develop severe pain. Second, pain on passive movements of the affected compartment. Number three, paresthesia, that is loss of sensation. And the late sign will be absence of distal pulses. It is the late sign, absence of distal pulses. Okay, so how you are going to make the diagnosis? First of all, it is a clinical diagnosis. You will be going to make it on the basis of clinical signs and symptoms, but you can also make it by placing a monitor and place a catheter in the muscle compartment. And if you find that the pressure is more than 30 mm of Hg plus above clinical signs and symptoms, your diagnosis of compartment syndrome is confirmed. Okay, and how you are going to manage this patient? So the management of this patient is fasciotomy. So what is fasciotomy? That you are going to make a longitudinal incisions, as you can see in this diagram. So you are going to make two longitudinal incisions. Okay, especially in the lower limb, because most common it is seen in the lower limb. You have to release that pressure. And when you are going to make these two longitudinal incisions, please remember your incision is going to be made on the skin, subcutaneous fat and fascia. Okay, and when you are going to make the incision, the muscles will bulge out. Okay, so this is your compartment syndrome. And please remember, very important point, if you are going to make your diagnosis late, or if you are going to perform late fasciotomy in the patient can develop rhabdomyolysis, infection, and it can need for amputation of the limb in the patient also. Okay, so this is your compartment syndrome. Please remember, very important topic.